Hey, so this is, I'm here with Patty today, and look, we've got a mountain, literally a mountain of medication and stuff, and I don't want to steal her whole story, but this is an issue that is all too common today, especially, that needs to be addressed. People that are being prescribed medication after medication after medication, and maybe I have to take this medication now because of this one or side effects of this, and the thing we're seeing is people don't want to live like this. They don't want to be on that. And I wanted her just to share her story of how we got to this point. Now you're on your way to throw it all away or turn it in.
Yeah, I'm on my way to the pharmacy to have them dispose of it all because
Amen.
I am done.
Good.
But 6 years ago, I injured myself on the job. I've been a flight attendant for 37 years. And those push-up bins and the heavy suitcases herniated one of my discs, and then my back went down from there. And I consider myself fit. I love to work out and everything, but this was painful. And the company sent me to pain management. No other doctor. I didn't know who I needed to see, a neurologist, I don't know, a psychiatrist.
Yeah.
But so they sent me to pain management, and this is what started my life. And he numbed me, gave me 5 medications right off the top. I had to take this gabapentin 3 times a day. Some of the others twice a day. There's muscle relaxant. There's 2 opioids, which you're hearing horrible things about all the time. And I was terrified of becoming addicted and ended up an old lady having to wash them down with liquor because they didn't work anymore. And trying to live my life, and I kept saying to my company and everybody, I don't want to do this. There's got to be a doctor I can see. So they finally let me see a doctor, and I had 2 back surgeries. One worked, my herniated disc improved, but I still have issues. I still have hip problems. But I didn't want to do this. Went off the gabapentin first, started decreasing that, asked him how to do it because I was terrified. I mean, you hear of all these people having overdoses and withdrawals and things like that, and I did not know how, so I started weaning off. When I went off the gabapentin, I lost 25 pounds. Thank you, Lord.
Amen.
And then I started asking them and telling them, as I kept saying, he kept giving it to me, and I kept saying, enough. I don't want any more of the gabapentin. And then I started weaning off the others. There's hydrocodone, there's muscle relaxant, meloxicam. Tramadol is, I believe, the other opioid. It was a time release, so it was a little not as strong as the hydrocodone. But, and then the other, I'm not even sure what it was doing for me. All I know is I was numb. And I could work out, I could do activities, but I was numb.
Yeah.
And underlying, the pain wasn't gone. Once the pain meds started wearing off, it hurt. And then I had to have the surgeries, and I had to go off my meds 2 weeks before surgery, and the pain I felt was incredible. So I knew it wasn't over, it wasn't gone, but I was going to find a different means of doing this. And so far, coming here with everybody has been a blessing. I finally see a light at the end of the tunnel. I still have issues, but it's early.
Yeah.
So and when I walk out of here, I walk out straighter, taller. I enjoy the day, and I haven't had any meds in me.
That's awesome.
So
That's a
yeah.
blessing.
Yeah.
Talk about getting your life back, getting away from something that could possibly steal your life away.
Yes.
Which we talked about the other day. I mean,
Yeah.
it's robbing people of their lives. It's creating dependency for
Yeah.
sure for many, many people. And they're not calling it an opioid crisis right now for no reason.
Right.
So if you're out there and you're watching this right now and you don't know what to do, I'm not saying that this office is guaranteed to help you, but maybe it can. I don't know. It'd be worth a conversation at least. And that's all we're saying is just, we want to get together, reach out to you and say, if this is your life, if you're going through something like this, if you're on this merry-go-round and don't know how to get off of it, at least just call and let's have a conversation and see if we can't put you in the right direction towards getting your life back.
And don't be afraid. It doesn't hurt. They don't do anything they don't have to do. They work on your issues, and you feel yourself being solved. Your problem is solving here. And I can work out without worrying about it. I can do yard work with my husband, and you know, I'm not young anymore, and I know I'm getting the arthritis in the hands, but hey, we all have those issues, and you gotta just stay young and strong in your mind and your spine.
Amen. Amen. Cool.
So.
Absolutely. Well,
Yeah.
thanks for tuning in. And again, if you have any questions, call us and we'd be more than happy to chat with you.